Good afternoon, good evening, wherever you may be. I am submitting this a little late, but I want to jump on in. So we're going to be talking about Mr. Stan Stein's case study. I battle with myself, but it's okay. We're going to keep pushing. And I will be coming out of the DSM-5. I feel like this information is always the best because the videos are great for me to first process it, and then I go through and I read it as far as disorders go. I did battle for a minute with major depressive and or generalized anxiety disorder, but it was major depressive with anxious distress just because when I was reading it, I was battling with myself, of course, like I said, on what was appropriate and what was the actual, where would I pull this information from. So as I wrote down the symptoms, behaviors, and stressors, I was able to more so differentiate the two. So I went with generalized anxiety disorder because when you think about the symptoms, based off of the case study, it says he suffered from, or his symptoms were stomach aches and diarrhea, lack of concentration. He tossed and turned until the middle of the night. So he struggled with sleep. And I'm sure that if you struggle with sleep and you're not sleeping well, you're tired, right? Frequently waking up to urinate throughout the night. He lacked motivation and he felt hopeless. Behaviors were he was lashing out at others, including his 7-year-old daughter, drinking alcohol, and in the past, he used cocaine. Not for a long period of time, but temporary, like a temporarily fix. His stressors were financial stressors. He came close to bankruptcy for his investment bank, fear of not living up to the family tradition, fear of not being enough for his wife, and fear or anxiousness of wary of future events. What could happen, the worst that in the possible circumstances. And the divorce of his parents and work issues. So when you think about that, when you think about generalized anxiety disorder, some of the symptoms are restlessness, feeling on edge, being easily fatigued, difficulty concentrating, irritability, sleep disturbances. It says muscle tension, but if you think about it, he has stomach aches. That can be considered a muscle, but okay. We'll continue to push for it though. It also says the disturbances of not being explained by another mental disorder, anxiety, or worry or having panic attacks. So when he went in, his key, and sorry I keep moving back and forth, but I'm on my laptop and my book. But he said he is experiencing nervous breakdown. So the next question would be, what is your diagnosis? So generalized anxiety disorder. Based on the diagnostic features of diagnostic features of your diagnosis, discuss how this applies to Mr. Stan. So going through the symptoms and going through this diagnostic criteria, you realize that he meets majority of them, and his parents divorced and his financial stressors started roughly 3 years ago, and his stomach pains started, I do believe, like 6 months, and he was irritable for about 6 to 8 months, according to his wife. So all of these meet up to the diagnostic criteria and what's presented. Now, I did say it was generalized anxiety disorder moderate, to kind of touch back on that, just because it's not severe. It is moderate. It could be severe if he does not get the correct help, which can lead to other problems. But as of right now, according to the case study, it is just moderate. And then the last question is, discuss which modality you would consider using for Mr. Stan and why. So I would start out with CBT, which is cognitive behavioral therapy. One, because I'm more familiar with that, but also two, because I feel like it will work in a situation because it focuses on depression and anxiety, the CBT modality. It helps with the individual to identify self and challenges negative thoughts and behaviors. It also creates and teaches them coping skills and problem solving strategies. So what's really weird, I would say, or crazy in the sense, we talked about this today at work because I'm currently dealing with a client who may have been misdiagnosed, and she meets so many criteria. But as a case manager, I would provide teaching and coping skills and problem solving as far as whatever the therapist that I'm working with provides. I realized that a lot of people that struggle with MDD or generalized anxiety disorder or anxiety disorder in general, CBT is the best fit for them, and it helps them to recognize the challenges that they face and how the behaviors contribute to their anxiety and or depression. So this is what I came up with. Like I said, I always enjoy reading and listening to other people's and what they have to say, because it gives me insight on things maybe I missed. So I enjoyed this, and I hope you all have a great day.